Okay. So today's video is on thermal heating. Our patient here suffered a patellar fracture about 6 weeks ago. So he is currently in the subacute phase of rehab, as well as he is kind of in the transition phase between the proliferative phase of tissue healing going into the maturation phase. So indications for this treatment are to increase extensibility, increase range of motion, decrease pain, and as well as promoting blood to the affected area. Contraindications, if our patient had any lack of thermal sensation, if he had any hemorrhaging, any known malignancies, or any issues with vascularity. So we'll come over here to our patient, Mr. Jake. So Jake, with you, we just got your cast off, yesterday. So obviously you're very stiff. You don't have much flexion or bending in your knee. And today we kind of just want to look at that. So what I think would be really good for you is if we applied some heat to your knee before we get on with our treatment. And basically what this is going to do is just kind of loosen up some of the tissue in there, make it easier to work with. Does that sound all right with you?
Yeah.
Great. So what would we do first is, before we apply the treatment, we want to come over here, kind of take a look at the area, make sure the skin is intact, there's no abnormalities or anything like that. So it looks pretty good here. So usually, I mean, we had it set up, but we could go to the hydrocollator or the thermolator. And then as far as protection for the patient, we want to put enough layers so that he's not going to have any burning of the skin. So one of these cloth pads, one of these sizes, is considered 2 layers, and we always want a minimum of at least 6. So I also added another 2 layers here, which equals 4. So 2, 4, 6. And then we have our heat right there. So we can come over here to the patient and kind of explain to him what he should expect. So with this treatment, I'm going to apply this hot pack to your knee. The first few minutes you might not feel much, but that's pretty normal. Okay, so just give it a few minutes to kind of ramp up. After that, it should feel warm, but at no point should there be any burning or discomfort. Okay, so if you do feel that, I'm going to leave this bell here so you could call us in case you need any help. Also, I'm going to set a timer I'm going to set a timer just so I can come back in and check on you, make sure you're doing okay. All right. So yeah, we would just apply this to the area that we're looking for. Right here's the knee. This one's kind of large. You know, they do make different sizes, but we don't have any here, so we could use a smaller heat pack if we needed to or wanted to. So yeah, basically we'd leave this on him for about 15 minutes or so. Coming in to check on him, maybe somewhere in between that. And yeah, and then afterwards we just come back, take it off. And again, we'd want to make sure that nothing happened to him during the treatment, so we just want to check the skin. And also just ask him, are you doing all right? How was the treatment for you?
Fine. It was okay. I feel great.
Great. And yep, that's basically it.